Okay, take two. Welcome to our live talk tonight. I believe we have both of our phones working here. Tonight's talk, we're going to be talking about lower extremities. So one of the most common things that we see this time of year is lower extremity injuries, primarily foot rolls or ankle sprains or inversion sprains. So tonight we're going to be talking about a couple of different things that you can do as far as preventing injuries, but also what to do right away when you get an injury and what some of the long-term treatments are. So just a couple of stats to start things out. The Bureau of Labor Statistics in 2017, 60,000 foot injuries causing lost time at work happen every single year here in the U.S. I was back home here just a few days ago. I was watching the doctors when I was up north getting ready for a golf tournament, and they mentioned that there's 600,000 knee replacements a year, and that's also followed up by 350 to 450,000 hip replacements a year. So there's a lot of musculoskeletal problems here in the U.S. One of my favorite quotes from Leonardo da Vinci: "The human foot is a masterpiece of engineering and a work of art." And that Leonardo da Vinci, not the Leonardo from the Ninja Turtles. Kind of interesting, all the Ninja Turtles are named after Renaissance painters. And do you know what the evil ninja group in the Turtles was named? With the shredder, the foot. So they tie into my talk as well. So what controls the foot? Well, just like everything else, the brain and spinal cord, and thus the nervous system. And so when you look at the nerves that come out, especially down into the lower extremity, this is where sometimes you can have a pinched nerve in the lower or a foot problem or foot pain, and it can actually come from the spine. I also like this graph up here because it shows that the nerves control much more than just the extremities. They also control all the organs. As far as what controls the foot, one of the most common nerves that most people know, this big yellow one here, is called the sciatic nerve, and it goes all the way down into your foot. In fact, from Cadaver Lab, when we tested the sciatic nerve, it's about the size of your pinky. You can almost lift up the entire body by it. It's like a tethered cord. But you can also see there's a number of muscle groups right around that. And this is where sometimes, if you had a pinched sciatic nerve, sometimes it's a chiropractic issue, but sometimes there can actually be a common symptom called piriformis syndrome, where you actually have a muscle that pinches on top of the sciatic nerve. And happens in about 10% of the population. Quick anatomy of the foot. The foot is made up of 26 bones, 30 joints, and 100 muscles, tendons, and ligaments. Nice picture of the foot here. So two of the lower bones in the leg, you have one on the outside called the fibula, it's non-weight bearing, and one called the tibia that is weight bearing. Here's a couple of the muscles and tendons that connect to it, and we'll specifically talk about some of the tendons on the outside of the foot here. One of them being the anterior talofibular ligament, and that's the most common ligament when you sprain an ankle. A couple of the nerves that run down into the foot. So this one right here, and I always think this one's kind of interesting, the medial plantar nerve and the lateral or outside plantar nerve, and then right between the two of them, especially between the third and fourth toe. If this right here develops what's called a neuroma on it, there's a term for that. Does anyone know the name of it? In the back?
Morton's neuroma.
Morton's neuroma.
Named after Dr. Morton.
Named after Dr. Morton. That was Dr. Bouch. Boy, you should help set up Part 4 exams for chiropractic students.
That was a question.
So there you go. Led up to this. So if I look at some of the different things in the foot, different causes of foot pain, corns, calluses, bunions, I think of different things like bunions then, almost like arthritis in the spine. Just because mom had a bunion or grandma had a bunion, well, maybe mom had improper biomechanics and so did grandma. So I think of a lot of different things like bunions or even hammer toe in that is potentially preventable, especially if you have the right biomechanics of the foot and lower spine. So prevention as far as injuries of the lower extremity. A, is your body ready for activity? Why do we see more injuries in the spring from raking than we do in the fall? Because in the wintertime, we're usually not as active. Proper diet and nutrition. Are you warmed up? One of the things we like to talk about before an activity, static stretching versus dynamic stretching. So static stretching is your typical, I bend down and I try to touch my toes. That's just a static stretch. A dynamic stretch is where I'm moving. So if I'm swinging my legs back and forth, and they've actually shown if I warm up with dynamic stretching, I'm less prone to injury. If I'm not warmed up and I go just into, I hop out of bed and I do a cold hamstring stretch, a static stretch, I'm actually more prone to injury. Static stretching is helpful, but you got to be warmed up first. Proprioception, one of my favorite words. I like to think of it like the sixth sense. It's also called kinesthesia. So if you look at your foot actually helps tell you where you are in space and time, I like to say. But if I think of balance, I get balance from my inner ear, I get it from my cerebellum, but my lower back, my knees, and my ankles also play a huge role as far as balance goes. In fact, sometimes you'll hear people, boy, I had an ankle injury long ago, and then over time, I eventually start to have some knee issues, and eventually back issues, and eventually balance issues. In fact, one of my new patients here in the last week had back surgery, and his balance, he said, ever since then has never been the same. So let's say you injure an ankle, and this is by far the most common type of injury. It's called an inversion sprain. It's where you roll your ankle over. And this right here, if you remember, we have the fibula, we have the tibia, and this right here is called the talus joint. So the very front of it, called the anterior talofibular ligament, most common ligament that we see sprained. Rarely do we see inversion sprains, but they do happen. You have a really strong ligament named after, it's similar to this muscle here, deltoid muscle. You have what's called a deltoid ligament right here. Not as common as an inversion sprain, especially for a lot of our athletes out there. So how do we take care of it? Like a lot of things, sometimes it gets a little confusing, kind of like back pain back in the day. You go to the doctor, they said bed rest. Well, we know that's not good. Kind of like back in the day, eggs were bad, now eggs are good. Well, what do we do as far as I sprained an ankle? And I apologize that this is a little blurry. I could have got a little bit clearer one, but I'll read through this. Pre-1978, they started to say, hey, you should start doing ice. Ice, compress, elevate. And then they added rest after that, and it became rice. And then we wanted to protect it in the late 90s, so it became price. Well, that wasn't good enough, so we added the police. And then a few years later, we took rice retracted, and now in 2019 going forward, it's supposed to be peace and love, and I'll go over some of those. So it gets a little bit confusing. This one right here, I do agree with police acronym: protect, optimal loading, ice, compression, and elevation. There's a couple of things I like and a couple I would take out, but it's peace and love is what we're supposed to be doing now. But this is where they talk about it here: avoid taking anti-inflammatory medications because it slows the healing process. But they also say avoid icing. And the tough thing I always tell patients as far as icing, yeah, there isn't a ton of studies on it. My cynical side says no one makes any money off of telling people to ice. But as long as we continue to treat multi-million-dollar athletes with ice packs, ice tubs, I'm going to treat my patients like we treat the top athletes in the world. And love it. So peace, love, and eventually I think we'll have peace, love, rock and roll. There'll be about 30 things that we're supposed to do. Last, just before I bring up our next presenter, we're going to go over stages of wound healing. Very important. So you sprain an ankle, and oftentimes a person may ice it for a day or two, and oftentimes within a week or 2 weeks, hey, it's healed, I'm back to normal, I'm outside of pain. Well, just like you can have diabetes, you can have hypertension, you can have cardiovascular disease, you can have a ton of different things without symptoms. The same with tissue healing, including, say, a sprained ankle or even in our realm, a sprained back. The inflammatory phase, we usually say 72 hours. It can go up to 6 days. And this is why sometimes you're raking, but it's not till a day or two later that you feel really sore. The next stages are where most of the healing takes place when you're out of pain. Proliferation phase and the remodeling phase. And depending on whose research you use, even that's a varied, some say it takes up to 6 months, some say it takes up to 2 years. So as far as acute Inflammation, as I mentioned, 72 hours to 6 days. Regeneration, this is where a lot of our treatment plans are based on. So you hurt your back, you see a chiropractor or a PT, we'll usually recommend at least that 6 to 8 weeks, no different than a broken bone, because that's the minimum repair phase. Remodeling, this is where home care and why we want patients to continue to stretch and exercise even when they're not in here on a regular basis, is because that healing process, in here it says 12 months, some research says 18 to 24 months. Just a couple of things as far as soft tissue healing goes, and when Dr. Lexi presents, she's going to actually go over a couple things that you can do to help speed up healing. You have stage 1, stage 2, stage 3. So let's take instead of a sprained ankle, let's take a scar on my arm or a cut in my arm. Right away, what the body wants to do, it wants to bring in some neutrophils there, it wants to bring some white blood cells. It also wants to just plug up the hole because we don't want to bleed out. So right away, what we have in the skin, if I get a scar or if I sprain an ankle, I'm going to have what's called collagen also enter the area. Now you have 28 types of collagen. 3 comprise type 1, type 2, type 3, make up 90% of your collagen. So right away, we have type 3 goes in there. And then eventually, over time, the repair and remodeling phase, that type 3 collagen has to remodel into type 1, which is the primary collagen in your body. And if you're not remodeling that and you get a cheap scar that doesn't heal properly, whether it be on your arm, whether it be on a sprained ankle, that tissue ends up, or that joint in particular, ends up weaker. So to present next here, so now we've sprained an ankle, we've iced it, and ideally we start doing that right away. We usually recommend icing 15 minutes, once an hour. I like an ice bucket for an ankle or for a wrist. For a back, we recommend ice packs. So in addition to that, what else can we do? For that, I'm going to bring up Dr. Matt, Dr. Lexi, and Dr. Bouch. I believe Dr. Lexi, and I apologize if this was a little low. I just remembered I did not turn this on. So this was all for show. You can turn that on.
Oh God.